So I'd like to go ahead and introduce our CarePartners Home Health team that has put today's presentation together for you. We asked them to share with you how they have found their way forward with Compass, starting with completing their training. They have a very large home health and outpatient system up there that works collaboratively with Mission Hospital. So they have, it's my understanding, they have 9 outpatient facilities, of which 8 got trained on the Compass model, and one is because, I'm told, because they work mostly with prosthetics. So how they completed their training, what they have done to work collaboratively with the PACs, the post-acute coordinators, and the advanced practice providers and others in the Mission Health system to implement the model with their patients and therefore begin to see improvement in the outcomes as a result of all of their hard work and collaboration. So I would like to introduce Jane Anderson, who's a physical therapist from CarePartners Home Health, and Nora Hunter, who is a nurse with CarePartners. And I'd like to turn over to them to walk you through their journey, and we'll have plenty of time for questions at the end. So Jane and Nora, we'll ask that you just take it away.
Okay, very good. Hello everyone, I'm Jane. I'm a physical therapist.
And I'm Nora. I'm the clinical nurse educator for home health.
And I just wanted to mention that we're both at what we call educators. We're half of an educator team, which also includes an OT and another nurse. But the two of us are considered the Compass leads here at CarePartners. And just to let you know a little bit about our setting, because I know every setting is different and has different needs, we're CarePartners, and we're a nonprofit organization, and we have the full continuum of post-acute care. So we have inpatient rehab, outpatient, home health, adult day, hospice, palliative, PACE, a lot of different things. But we are from home health, and we are large, well, we think we're a large agency. Some national organizations are much bigger, but we do have a staff of about 70 plus therapists and about 125 nurses, something like that. Mm-hmm. So there were a lot of people to get on board with the Compass program. If you have a smaller agency, it would be a lot simpler, but ours is big. What we want to share with you today is our journey, we're calling it. It's still, want you to know, it is still very much a work in progress. We're going to tell you what we've done, what we wish we had done, and what we hope to do. And I feel obliged to also make a little disclaimer. We don't consider how we have implemented the Compass program to be the only way or the best way. It's just been our way, a little bit of trial and error, and we know that every home health agency and outpatient clinic is different, and hopefully we can all learn from each other. So, starting at the very beginning, we first learned about Compass when we attended the Compass study workshop at Mission Hospital, and then Mission is our affiliate acute care hospital, that's the intervention arm, and that was in September. We found that workshop was very inspiring, and we were proud to be a part of the Compass program. So we were quite excited about the study, and then we learned that the implementation date for Compass was in a little over 2 weeks. So that came as a bit of a shock to us. One of the problems that we had right from the very beginning is Nora and I were there, as well as one of the inpatient rehab folks. However, she has since not been affiliated with the program because it doesn't include inpatient rehab, but we were lacking an outpatient representative at the workshop. So we quickly had a meeting with them when we came back. But I have to say, it's really important. The takeaway from that start that we had was to make sure you get your leaders on board from the very start. And I felt like that the person that didn't come to the workshop kind of lost some of that inspiration that we got from the workshop. So that was in our very beginning. If we could move down just a little bit, Rika. Rika's going to control our agenda here today. She's much smoother at this than we are. So next we're in the preparation phase, or the what do we do now phase, as we kind of think of it. So Nora and I utilized the website training, which was very helpful. It was certainly a very appropriate supplement to the workshop, so that we felt like we had a little bit more understanding. The way we started looking at what our needs were and how we would begin was we looked at the 4 directions of the compass. And there are many things that we felt good about going in. We felt good about the therapy skills and movement matters. Our therapists were very familiar with the tests that were used for compass. Many of our staff have a strong neuro background. So that was very helpful, we thought. And we felt very good about our nursing skills in areas like med management. But there were some things we wanted to address a little bit more. And one of those was with the know your numbers, focus on blood pressure.
We decided to do an assessment equipment need and discovered that our therapists needed better quality stethoscopes. And the ones that we were using were like out of those play kits. So we wanted a stethoscope that would allow them to be able to accurately hear when taking blood pressures. So we had ordered a better quality stethoscope for the therapists, and home health paid for those. We also realized that we needed 2 blood pressure cuff sizes. We discovered that a lot of nursing were taking blood pressures on the forearm. So we were getting some inaccurate blood pressures. So we decided to order large cuffed blood pressure cuffs, and our foundation paid for those.
So we got our equipment in order. The next thing we needed to do was introduce the Compass program to everyone that needed to know about it. So we started first with the therapists, and with them the emphasis was on movement matters, Otago, life, grasp. We put a little bit more therapy emphasis at that time, and we also introduced the scientific statement it's on the website, the physical activity and exercise recommendation for stroke survivors. We found that very helpful. I think it gave us the, are we still here? Hello, are we still on?
You're still on.
Okay, good. I thought that was a great article, and I really recommend everyone on the staff to read that. It made us think of what, if you're a physical therapist, this will mean something to you. Marilyn Moffat, who's the cardiopulmonary guru for the APTA, said that a stroke patient is a cardiovascular patient. So it gave us the opportunity to put a little bit more emphasis on aerobic conditioning for the patients, which we feel is a principle of Compass. So we started with the therapists, and then Noré, you want to talk about the nurses?
Yeah, I created a storyboard, and it was to organize illustrations of the Compass program so our staff were able to visualize the sequence of the Compass program. And it was a useful tool when presenting the program during in-services for the department leaders and office managers and the field staff. The storyboard is displayed now in a high traffic area to remind the staff of the program and encourage the clinicians to work collaboratively to ensure the patients partake in their self-management. We also posted up posters reminding them of the Compass program, and we also communicated with the office staff that take in the referrals. We didn't know at this time where to look to identify Compass patients. So we wanted to make sure that they all looked out for the stroke and TIAs that were going home, discharged home from the hospital. And also we did in-service for the leadership.
So the leadership presentation included both the administrative people here at CarePartners as well as community physicians, and so they were very interested in learning about Compass as well. So after that was the introduction, and we felt like everybody got introduced. And then we looked at assessing the need for any staff training. And at that time, we implemented a number of different things. For therapy, we felt we needed to do a review of correct method of taking accurate blood pressure measurements. At this time, we didn't realize that our patients were going to be, our Compass patients were going to be going home with their own blood pressure units for home use. So we were thinking, which now we rely on, but it still is really important for the staff to make sure that they were very accurate. So this, we also, because of the timing of this was in October now, we were able to incorporate that into our annual competency, and that gives it just a little more emphasis and attention by the staff, we think. For therapy, our agency has a real strong commitment to increasing therapy medication education and improving their knowledge base. So we did in-service training by our pharmacists on the Compass formulary antihypertensives. We just chose that particular group because of it, and we made a focus on side effects and the impact on exercise and activity. And we also made that a part of our annual 2016 competency. So that would mean that any new person that we have on board with us, they have to complete the competencies for that year. So our new people will always be updated in that as well.
Nursing identified a need for coaching lifestyle choices, and it happened to coincide with our agency staff training on communication and healthcare and motivational interview. So that was helpful to kind of move into working with Compass patients and educating them on self-management.
We felt that therapy and nurses would benefit from a review of vital sign parameters and appropriate follow-up. We do have agency parameters, and then we do have patient-specific parameters on referrals if the physician thinks that's important. So we made sure that everybody was real clear about what our parameters was. And another thing that occurred during this time was doing more training in the area of depression screening. Now, all of you in home health know that we do use the PHQ-2 in OASIS. If you're an outpatient, perhaps that's not familiar to you. It's the first 2 questions of the PHQ-9, and these are the gateway questions that screen for signs and symptoms of depression. It's not a diagnostic tool, it's a screening tool. So everybody in home health was very familiar with the PHQ-2. But what we did was we did training in the PHQ-9, and we developed an agency process. We feel that this fits in very well with the mood matters principle in Compass. And our process is that all of our patients are screened at various time points with the PHQ-2. If they score 3 or greater, which is an indication of further assessment needed, the staff will then, it was built into the computer that they would go right into the PHQ-9. And in the PHQ-9, there is an item that assesses suicidal ideation. The impetus behind this kind of coincided with our impetus because it is a joint commission recommendation with the depression screening, and our own agency has noted an increase in depression and suicidal ideation in the general patient population. And we all know with stroke patients, they're more at risk for depression. So it seemed very fitting, and we feel that this was an important training to do for our staff. Our takeaway from this staff assessment is, one, ideally you want to prepare before the start of the program. And see, we've been kind of doing this all along as we've been doing the program. It would be better if we did it before the start. Another takeaway from this is we really think that mood matters is very important, and we have a real opportunity and responsibility to make sure that we're screening for depression and getting appropriate follow-up. In this session, or this section of our Compass implementation, we really feel that visiting staff appreciate this patient-centered training. They really liked it. And another thing that comes up, this may be a lot of attention on maybe a small percentage of your population, but we found that Compass principles really benefit all of our patients. So all these things that staff were learning about knowing the numbers, assessing for and screening for depression, and better communication in healthcare for self-efficacy and such, all that really benefits all our patients. So we were really glad to see that. So if we moved into our implementation concerns, Nora's and my concerns.
The
right.
reality.
So yeah, here we are in the real world now.
Yes.
First one was, how do you keep a busy visiting staff on track with COMPASS objectives? So that was a challenge because our staff are really busy, and they're busy with patients of all different diagnoses, different programs, whatever. We want to make sure that they were really keeping COMPASS objectives right in their minds. So one thing that we did was we modified the checklist to make it a little bit more detailed. Rika, do you think we could show the checklist now?
Yes.
Very good. Nora and I practiced trying to do this, but it just was too cumbersome. So Rika, you're doing great. Okay, so this is this checklist, and please bear in mind that this was just made up by us, trying to base it, of course, on everything we learned from the workshop and from the website and the trainings, and then taking a look at our staff when we looked at who's got a lead role, who's got a participant role. And I think the message that comes across is that everybody participates a lot, and we have to support each other. So the little check mark is a participant, the L is a lead role. For example, taking blood pressure every visit, well, that's a home health standard, so everybody across the board has that. Teaching patients and caregivers how to take blood pressure with home monitors. We've got a nursing lead, but PT, OT, and speech are an important part of that. So this is how this checklist works. So we tried to get everybody on board. For example, reviewing lipid levels. Normally that would be a nursing lead, but we encourage the PTs to think about that because exercise can impact lipid levels. So you can see with all the different directions, the north, south, east, west, there's lots of different things that our group, everybody's got an equal role, and then some, there's a lead. We can screen down to the very bottom of it, and that would be good. And then at the very bottom of this, we've got the e-care plan. And the first objective we have is encourage patient to go to neuro follow-up appointments, because we have seen that to be somewhat of a problem with a few patients, that they don't understand the benefit of it. And so if everyone is encouraging them to do that very important appointment, we can get better compliance. And reviewing that e-care plan with the patient and caregiver after they go to that appointment. So we feel like that was pretty important. On the back side of that checklist, we just put the COMPASS directions and all the things that are a part of that. We gave staff the parameters, the numbers, the guidelines, so that they would have those. And at the very bottom, we added the site for further study for the staff, and they could go register. So this is actually proven to be pretty helpful. Busy people, they like things, they like checklists, they like, need to know things, and this, they could just take out their checklist, and when they got a COMPASS patient, maybe it would be their first one, and just review it, and then they were pretty clear on what their role was.
And we scanned this and went on ahead and emailed it to all the field staff so that they could have it on their computers so they could bring it up.
Yeah, so we think that this was one of the better things that we were able to implement that really got the staff paying attention. The next thing we did was at...
before you move on for just a second, this is Amy.
Yeah.
Hey, this is really fantastic. Can you just show this, Rika, can you show the checklist again? Back up for just a minute. I was just trying to take it all into my head. Okay, yeah, go down. Okay, thank you for doing that. Fantastic. I love that.
One thing I saw when I was going through the documentation of one of our COMPASS patients, it was a patient that was on the fence about quitting smoking. And I could see in the documentation how much the nurse was encouraging that. But then I saw it also in the therapy documentation too, that they were encouraging the patient and how they would be able to exercise better and all that. So it was kind of like getting those, collaboration and getting that message, that consistent message out there. Like a broken record. It's good. So that was one of the things that we did. The next thing was we did program reminders and updates during staff meetings. For example, when we finally learned that these lovely home blood pressure units, which were, they're good units too, they were accurate. Noré presented to the staff what the units looked like and anything that they needed to know about it. Noré and I have put, because we don't have a lot of COMPASS patients. I think right now we have 8 or 9 COMPASS patients. So we have begun putting notifications in the patient's chart, and now our office staff are doing that regarding the COMPASS status. So it'll say this is a COMPASS patient. It'll say this is when their follow-up appointment is with outpatient neuro. So we found that that was a helpful thing. We do intermittent chart audits, and because our numbers aren't too high at this time, that's kind of feasible for us with our time commitments. And we've been doing staff reminders. And that's things, here's some of the things that we've needed to remind staff about. We want to remind them that the referral order that comes in may not be as comprehensive as it needs to be based on patient need. So we remind them to make referrals to other disciplines as indicated. You know, PT ends up a lot on these referrals, but some of the other disciplines get missed. We also remind staff to think patient self-management all the time. I mean, that certainly is a really important goal in home health for all patients. You know, oftentimes they do well when we're in the home, and then we discharge, and self-management isn't what it should be. We really encourage the patient or the staff about owning the transition. And something that I'm just adding in here that's not on this agenda that we wrote up is that what we've seen is patients, I saw a really great patient, a COMPASS patient, just this last week with one of our new speech therapists. And the patient wife was a CNA, and she was really on board. But she said, you know, we are part of the COMPASS program, but we don't quite understand it yet. And yet her health literacy was pretty high, and they were both very motivated. So it kind of spoke to me that you can be motivated and understand things, but you still need that basic understanding and have it be reinforced. So I mentioned that to the staff the team that was working with this patient, and I could see in the documentation that they're spending a little more time with the patient and his wife so that they're understanding what it is that they are part of.
So how do you keep a busy office staff on track with the referrals? What Jane and I do, we have team rooms and we visit them weekly, and we ask them, are there any new COMPASS referrals? And we have eventually been able to get the office staff to notify us by email that we have a new COMPASS referral. So that's refreshing.
Yeah. So our next section is our challenges. Let's see, do you have that one? I'm not sure it's on there, but let me just speak to you very quickly about challenges. Tracking referrals has been challenging for us. About a month or two into the program, our PACs began marking the patient as COMPASS within the referral and documenting the outpatient neuro appointment. And so that was helpful, but it's still a challenge. It's kind of manually challenging to go through the discharge summaries and find it. The ideal, in our opinion, this is just our opinion, would be to receive a regular report from PACs with patient names. We think that that would make that part much easier for us. So our takeaways from this implementation phase is to find a reliable and efficient way to track the COMPASS patients. Anticipating home health referral may not be as comprehensive as it should be based on patient needs. And most home health agencies do regular case conferences. We have just started doing those again. It's a little challenging with a big office with people that are seeing patients in territories that are quite far from the office, but we now have regular case conferences. So bringing up having those patients part of the conference and bringing up their goals during conference, I think, keeps them on track. So that was something that we're working on and working towards. So what are we working on right now? What is current? Well, we are looking to develop a closer relationship with our APPs. Right now, we don't have it. ideally, we'd really love to get the outpatient neuro visit notes. We've found that the e-care plans are in the home, so staff can find those e-care plans. We found that to actually be the easiest way. But the e-care plans are really designed for the patient, so that's great to review those with the patients. But our clinicians would really like to see the more in-depth assessment from those neuro visits. So we haven't started doing that yet, but we would like to build a better relationship with that, the APPs. We also see that we would like to get our social workers involved. They actually came to our trainings when we did the Compass introductions, and we would like to get them to assist with transitions to the community. They're really our community resources, and encourage them to provide resources to the website. And as I mentioned, the weekly patient case conferences, they don't conference every patient, but we're trying to make sure that the Compass patients get in there right now.
Yep.
We're a little biased right now,
Yep.
So we're working on that. So, and pending staff training, tomorrow I'm doing an Otago program training for our PTAs.
And dietitian in service on patient coaching for nurses. We want to get the Mediterranean and DASH guides to the patients. And so we are trying to recruit some nutritionists to do an in-service for us.
You know, and you know, the reality is when staff have a full caseload and they're really busy, in-service training can be hard to find time to do. But our OTs seem to have more fluctuation in their caseload, so supervisors have approved the OTs to go to the Compass website when their caseloads are low and do some of the training modules on LIFE and GRASP. The last thing I want to present today, are some notes from CarePartners Outpatient. These came from Laura Dialis, who's the Compass champion for Outpatient. And you know, everything is different there's so many differences between home health and outpatient. So she's giving a little bit about what their experience has been like. She said that their communication with the PACs has been very beneficial, understanding the patient, answering questions. So that has been a really good collaboration. They too find that tracking referrals have been challenging. Now, part of that may be that from home health, we aren't identifying them as Compass patients when they go to outpatient, so we have some ownership of that. But then also finding that with patients that come directly from the hospital. They said that their therapists are now consistently monitoring vital signs, although she mentioned that it's still not always clear about parameters. And she said that this Compass program has really reinforced the responsibility of owning the transition. That has always been a priority for them. So this is something that just reinforces what they always have known is an important thing to do. So that kind of wraps up our finding our way with Compass. Like I said before, we are definitely in progress with this and always trying to improve. We definitely see the benefits.
We consider this best practice for all of our patients, not just Compass.
So does anyone have any questions or comments or anything they would like to share?
Are we still on?
Yes.
Oh, okay.
We didn't
And, just as an FYI, after this webinar, I will send these two documents out to you guys, so all of you on the call today can have this as reference.
And we will be posting them later after we had all 3 waves trained. We'll be posting on the website as well. I want to thank Jane and Nori for sharing their journey, and this is outstanding. And I think the checklist, as Amy said, is really, really, really useful, I think. And so we want to open up the floor now for any questions or comments of Jane and Nori.
Hey, Jane and Nori, this is Amy Pasqua. Again, thank you for the wonderful presentation and for really running with the Compass intervention and applying the principles and modifying those principles we're actually capturing, or how should I say, packaging those principles in a way that would work for your facility institution. So thank you so much for the wonderful presentation. how long, so can you tell me in the process of doing this, how did you, can you say a little bit more about how you came to develop the checklist? Like, what led you to do that? How, was it just the two of you working on this and saying this is how we're going to implement this or rolling it out? Or how did you actually come, what was that process like, if you wouldn't mind commenting on that just for a few moments?
Well, the reason we did the checklist is because, you know, we don't have a lot of COMPASS patients. So what we would find is that people would say, I've got my first COMPASS patient. What is my role? And it was like, okay. So they seemed to want something very specific that kind of pulled it all together.
Something tangible, something to keep them focused. And we felt like it wasn't necessarily spoon feeding them, but to assist them by giving them a tool that they could have and it would guide them.
And it incorporated both what is already on that very nice checklist, but it also incorporated things from those webinars. I don't know if I mentioned it. Those webinars were very helpful to us.
Yes.
So we took things from both of those to make the checklist.
Yep.
And it's just, you know, it's kind of a easy to read, quick way for people to kind of capture that whole collaboration and reinforce that. So.
And our staff like checklists.
Yeah, they do. I like checklists.
I do too.
I do to-do lists, checklists, you know, I don't know. It's my age.
Mm-hmm.
So
Thank you.
That's how
Jane and Ray, this is Sarah. Sarah Lycan. Do you guys have, can you share with us any examples of patient feedback or therapy or nurse feedback from your agency regarding the impact of COMPASS to their practice?
some of the feedback that I've gotten from therapists is that they feel that they are much more comprehensive and they're working closer with the whole team and with reinforcing, like with speech. You know, I've encouraged them when they've got patients and they're working on cognitive retraining, for example, and they sit for a long time. So our speech therapists are getting patients up and standing and moving a little bit, really encouraging all that movement. So that's something that's a little new for nurses and for speech therapists. So it's just they've kind of broadened their focus a little bit so they can support each other's goals. I think they really like that. I really see they see the benefit of this program. I think they also, it has made them think more, and they get it, how important it is to not have patients fall into the hole, you know, at transitions. You know, self-management is a cornerstone, it seems, from the COMPASS program, and that's something that I think has been a focus very recently for therapists, for example. How many of our patients work well when they have therapy, but how well do we prepare them to self-manage? So this program really supports that, and I've heard that feedback as well.
Yeah, the same with nursing, and also the nursing feedback working collaboratively with therapists for the same goal and motivating that patient towards self-management. Also honing in on numbers. We had a, excuse me, an incident where a patient was having high elevated blood pressure readings, and nursing honed in on that and reported that. So focusing more in.
Mm-hmm. So I think that has been very common feedback that I've gotten from staff that have had COMPASS patients. You know, for therapists, speaking as a physical therapist, I think they are seeing the benefit of seeing the neural patient is also a patient that needs cardiac retraining. Mm-hmm. It's the statistics that COMPASS gives about how sedentary stroke patients can be, like 75% of their day spent sitting or lying down. That kind of hit home for people. So we're really trying to get people moving. And we've got to find the right way to keep them moving too.
Excellent.
That's what-
Thank you guys so much. This has been just wonderful. I've really enjoyed it. Thank you.
Thank you.
Thank you.
Karen or Sarah, is there anything else you want to bring up today? Karen's shaking her head no. Sarah, how about you?
No,
Anything
no, not today.
We just want to thank Jane and Nore again. This has been outstanding. We continue to learn as much from people like Jane and Nore as you all do from us. So we very much appreciate you sharing how you've implemented at your agencies and in your systems. And this is just an example of going forward in the coming months, what I was mentioning earlier, now that we're going to monthly webinars, that we will be sharing with you some other education and training tips and pearls, and we'll be calling on others of you to share your experiences with your hospitals and in your communities. But today, again, we can't thank you enough, Jane and Nore. We know that it took a lot of extra time to put this together, and you just did a fantastic job. So we will be sharing the 2 documents that Rika had up on the webinar a little bit later today or tomorrow. And remember that our next meeting is on Tuesday, May the 16th at 1 o'clock. So be looking out for a revised calendar invitation from Rika for that. And as always, if you have any questions or anything you want to share with us, please let Rika, Karen, Sarah, or me know. And we hope you have a great rest of the day and week, and we'll be in touch.
Thanks, guys.
Bye.
Thanks, Nore.
Thank you.
Bye.